Hello everyone, welcome. In this video, I'll talk about one very important gynecological disease, and that is endometriosis. So you may have already heard of endometriosis. It is abnormal implantation of endometrial tissue outside the uterus, commonly the fallopian tubes, ovaries, pelvic ligaments or peritoneal ligaments, peritoneum, cul-de-sac or rectovaginal septum, and those are the common areas where you can have abnormal implantation of your normal endometrial tissue. Okay, so what's the big deal here? So whenever someone has this kind of abnormal implants, that he will experience cyclical pain, especially just before the menstruation, and also that continues during the menstruation. And this happens because whenever someone goes through normal menstruation, in that menstrual cycle, and the endometrium sheds, and the endometrium does not only shed in the normal uterus or normal location, it also sheds in the abnormal implants, and that's why there is creation of pressure which causes pain. And this process can be occurring for multiple times or multiple cycles, and this can ultimately lead to excessive bleeding that induces an inflammatory state, and that can cause fibrosis in this region. Uh, হ্যাঁ দাঁড়া একটু পরে আসতেছি খাবো আসতেছি. Okay, so whenever you have someone has these problems, someone has those endometrial implants in multiple sites, each of those sites can lead to uh, some unique features or unique manifestations. Like if someone has endometrial tissue in just behind the vagina, which is maybe in the rectovaginal septum or maybe in the cul-de-sac or posterior cul-de-sac, those can produce dyspareunia, especially deep dyspareunia, which is pain during sexual intercourse, especially during deep insertion, and also dysphagia, which is pain during defecation. And sometimes if the implants are in the fallopian tube or in the ovary, multiple cycles can lead to scarring in the fallopian tube, and also it can lead to formation of chocolate cysts in the ovary. This happens because multiple cycles of menstruation leads to accumulation of blood, which actually degenerates and causes a chocolate color, causes formation of a chocolate color fluid inside the ovary. And this can lead to like ovarian problems, and also fallopian problems can lead to infertility, or we can say subfertility. And sometimes those patients report chronic progressive pelvic pain, and this occurs due to widespread fibrosis inside the and inside the pelvic cavity. And some people might report that they have increasing pain in the abdomen, especially when they stretch their abdomen when they exercise. And this is also a common problem, especially when you exercise in a irregular rhythm, that it can cause this pain to increase. So those are the common manifestations of endometriosis. And even in some patients, endometriosis may be asymptomatic, and it can be found incidentally during other procedures, like other abdominal surgery, or maybe during investigations due to other reasons. But yeah, that's the spectrum of presentation of endometriosis. Okay, so with all that, then you go through to the clinical examination. So after taking this history, you will go through clinical exam, and you will start to feel the abdomen. And sometimes you might have an abdominal mass or adnexal mass, especially whenever someone has endometrioma, or whenever someone has a very large endometriotic focus in the pelvis. And if you want to move the uterus sometimes tend to be fixed, especially in patients with severe or high amounts of endometriotic focus in the pelvis, causing inflammatory reaction, and fibrosis can lead to stagnation, or can lead to fixity of the endometrium, fixity of the uterus.